Good morning. It is a pleasure for me to be here and to summarize for you briefly results of the CLL-11 study. Just to put this a little bit in context, these are the study goals of the CLL-11 trial. Because many of the CLL patients are elderly, one goal was to establish chemoimmunotherapy in older patients with CLL and comorbidities. And the other important goal was thereby to compare Rituximab as a standard anti-CD20 antibody for this disease with a new anti-CD20 antibody, Obinutuzumab or GO101. This is an engineered antibody, so-called type 2 CD20 antibody with a modified binding region and a glycoengineered FC region. And in preclinical models, these two antibody features have been shown to result in greater activity against CLL cells than Rituximab. Now, this has been done in our trial. This is the study design. We have enrolled 781 patients with previously untreated CLL and coexisting medical conditions. And those patients were then randomized into 3 arms, GA101 plus Chlorambucil, Rituximab plus Chlorambucil, or Chlorambucil alone. And then all 3 pairwise comparisons for the 3 treatment arms were made subsequently. The results of the comparisons of the antibody arms with the chemotherapy-only arm were presented previously at ASCO this year. And here at ASH we present the results for the first time of the head-to-head comparison of the GO101 arm and the Rituximab arm. This slide summarizes the safety profile of the combination of GO101 and Chlorambucil. You can see that there were more adverse events grade 3 or above in the GO101 arm compared to the Rituximab arm. This was mainly due to an increased rate of infusion-related reactions in the GO101 arm. You can see the difference, 20% versus 4%. And this is a defined safety risk of the treatment with GO101. Importantly, these IRR occurred exclusively during the first infusion of the antibody, but not during subsequent infusions. And we implemented measures during the trial to overcome this risk. With vigilance of the doctors during the first infusion of this antibody seems to be the key to further increase the safety of this treatment. There was no problem with infections with this treatment. Coming to efficacy and summarizing this briefly, you can see that the overall response rate in the GO101 arm was higher than in the Rituximab arm. Especially there were more complete responses in the GO101 arm, 21% versus 7%. Minimal residual disease, so the absence of detectable disease on the molecular level, was also studied using a PCR technique, and patients were designated MRD negative in the marrow or in the blood if less than 1 cell of 10,000 was detectable. And as you can see here, the MRD negativity rate, which is something considered beneficial for CLL patients, was significantly higher in both marrow and blood in the GO101 arm compared to the Rituximab arm. So progression-free survival was the primary endpoint of the trial. And for the head-to-head comparison of the GO101 arm and the Rituximab arm, the hazard ratio was 0.39. You can see the difference in median PFS, 27 months versus 15 months. So this slide clearly tells us that GO101 is superior to Rituximab in combination with Chlorambucil in this setting with regard to PFS. As I said, we earlier also compared GA101 Chlorambucil versus Chlorambucil alone, and you can see here the difference in PFS for this comparison. The median PFS in the GA101 arm, 27 months versus 11 months in the chemotherapy-only arm. So a huge difference in median PFS between these 2 treatments. Finally, I would like to summarize overall survival data. Treatment with GO101 in combination with Chlorambucil resulted in an overall survival benefit for these patients compared to chemotherapy alone. And if we look to the head-to-head comparison, the overall survival data are still immature, however, look quite promising with a hazard ratio at present of 0.66 and a p-value of 0.05. 08. So this is the summary. I think we can conclude that GO101 plus Chlorambucil as a first-line treatment of CLL patients with comorbidities, elderly patients, has an acceptable safety profile with the IRR to be kept in mind. It prolongs survival compared to chemotherapy alone, and it is superior to Rituximab Chlorambucil with regard to PFS, to complete remissions and molecular response in these particular patients. So I think this means a significant and potentially practice-changing treatment advance for this large patient population. I thank you then for your attention.